Alright, what's happening, guys? Welcome to another episode of Sensible Investing. My name is Jesse, and today we've got part 1 of 2 of my video deep analysis into Evolent Health. And I'll tell you what, guys, this has been a really deep dive. I'm talking more complex than any other stock analysis that I've done. And the reason being is because looking at Evolent Health, it didn't just involve looking at the actual company and the industry itself, but it actually involved doing a deep dive into what I believe is the literal pits of hell, which is the flawed American healthcare system. So quite a bit of detail to cover in this video, guys, so let's get straight into it. Alright, so the topics for today, we're going to be talking about, so we're going to be breaking this video down into a couple of parts, okay? So in part 1, I'm going to give you some context and background into why I'm actually looking at Evolent Health. So we're going to be talking about the industry, we're going to be talking about the American healthcare system. We're going to be talking about the micro and macroeconomics of this entire, industry in itself. And then we're going to be also talking about why I believe there's a need for not just Evolent Health services, but the actual services that as a whole they provide, which is population health management, electronic medical records, outsourced administrative services for healthcare organizations, and payers, and so forth. Then we're going to be talking about the total addressable market for Evolent Health, and we're going to have a really good look at their competitors. Following that, we're going to do a deep dive into the reasons why Evolent Health was sold off. And I'm going to take you through some of the evidence that I've found to try and understand whether the sell-off was justified or not, and if not, what are some of the, the key pieces of information pointing to the fact that it isn't justified. Then what we're going to do is we're going to look at management has the situation under control, and then we're going to conclude part 1 here. And guys, before we get into the video, just a couple of things. So Evolent Health, this is not a traditional value investment stock, and it is a very, very contrarian play. The way that the company is valued is based on the number of lives on the platform, the number of partners it has, the per member per month premium or money that they can make per member who are part of these big partner organizations, whether it be healthcare organizations or healthcare payers, right? So we're going to be looking at a lot of things that aren't, part of traditional value investing metrics. And so if that's not your thing, guys, look, I really appreciate it, but I genuinely believe that this is a contrarian play. And second thing, guys, is if you're really enjoying these videos, you're getting some value from it, you're learning a couple of things, feel free to share the love by hitting the like and subscribe button and leaving a comment. It really helps me to make more of these videos for you guys, where we do some really, really deep research into companies and look at things that people might not necessarily be looking at or thinking about. Okay, guys, so let's get started. So, a bit of context for you guys, okay? So why Evolent Health? Why population healthcare management solutions? Why this whole industry as a whole? And the reason is quite simple. So these two graphs will show you a couple of things. First, it'll show you the exponential rise in terms of U.S. healthcare expenditure year on year. Okay, and this is obviously much faster than at the rate which GDP is growing, and also faster than at the rate which their population is growing. Okay, so this is something to keep in mind. On the graph to your right, you'll see that US has basically the highest amount of healthcare spending per capita, which is far above what the actual GDP per capita is. So that's another thing to keep in mind. Okay. Now you guys might be wondering, well, what does this all mean? Okay. So what does this rapid increase mean? What does this excessive spending mean? What does spending beyond what the GDP per capita mean? What does all of this mean? And basically what this means is we have probably the most inefficient healthcare system in the world, okay? And obviously this is unsustainable unless, the company continues to overspend and go into debt, okay? But in one word, it's inefficient. It's inefficient, it's unsustainable, and clearly something needs to change. So if you guys have deep dive into the healthcare system, you'll know exactly what I mean. Okay, guys. So let's talk about this a little bit more. So let's talk about, okay, so the healthcare system is inefficient. What does that mean for Evolent Health? Okay, what does it mean for their total addressable market? Their competitors? Well, this means a few things, okay? So first of all, it means that there's an opportunity for Evolent Health to not just help healthcare providers, but an opportunity to help healthcare insurers or healthcare payers, right? So we've got the providers that provide the service, and then we've got people that pay the providers to provide the service, and then we've got the people that insure the payers and the providers, for example, if things go wrong and they overspend, okay? And so this roughly translates to, a total addressable market of about 60 billion or more. And it's probably going to be a lot more than 60 billion, okay? Now, the reason why the market has, I guess, exploded in the last few years. So, as you guys are probably aware, Obamacare, okay? So when Obamacare came out, basically, to the effect, it said, hey guys, look, we will accept anyone and everyone. We will charge everybody the same rates regardless of pre-existing conditions and sex, and don't worry about age as well, right? So we'll take care of everybody, right? So that's sort of really, healthcare for all, something, very socialist mindset. Look, we'll take you guys all in, okay, guys? And so the reason why that's not good is because if you have a think about it, healthcare providers were encouraged to just provide healthcare en masse. So quality went out the window, but quantity was what they focused on. And as a result, the patient outcomes were horrible. And as you can see from the graph over here, you'll see that the healthcare costs have absolutely exploded because providers were too busy reaming the system, going, oh, we'll just give you more care and more medicine and more drugs and more services that you don't need, and they did very little due diligence on the actual patients themselves. So as a result, healthcare has exploded. It's highly inefficient. Everybody's just reaming the system, okay? So this has led to obviously the need for change, right? And that's when something called value-based care is born, right? So we're not talking about fee-for-services anymore. We're not talking about people that pay for the amount of services rendered, but we're actually talking about people paying for the quality of services rendered, and then also applying a subsequent penalty for underperformance or non-performance. And so as a result, we've had a massive paradigm shift where patients, not just patients, but payers were no longer to accept mediocre or subpar care, right? So they've said, look guys, we're going to need you guys to share the risk, right? So as you guys can see the little pictures below. So look, long story short, what this basically says, these two pictures, they say is, look, you've got your fixed costs, okay, we get that. But your variable costs, if you go over your variable costs, well, too bad, buddy, it's on you, right? So if the hospital or the healthcare provider goes above the variable costs, too bad. And so, as a result, that's no good for the payers because then the payers would have to then foot the bill. So then they've said to the hospital and healthcare providers, they said, look, we're not going to foot the bill. If you go over, that's on you. So that's created a bit of tension amongst the two, right? It's created a bit of tension amongst the two where they had to come to some sort of agreement where they'll actually share the risk of exceeding their budgets. So that's basically what value care means, right? So let's now move on from here. So let's now talk about the types of value-based care. Okay, so what is value-based care and how do we summarize it into a concept? And basically it's called capitation. Okay, so we've got full or partial capitation. What this means is that the payers will get a set amount per member per month for all of their services. Okay, and that's all they get. And so anything that they go over, too bad, right? So that's the shift. They're saying, look, we're just going to give you this much budget to work with, so you do what you do. And so as a result, this has actually forced the providers to become more efficient. So whether it's full capitation or partial capitation, what this means is that the providers have taken on a level of risk where they have to make do with the budget that they have because that's all the budget they get. And so that's how value-based care was born. And so you guys might be thinking, okay, well, cool, that's good, but what? Okay, so what's, why Evolent Health, right? Well, I still don't understand why they need the services. And the answer to your question can be found in the sentence or two highlighted in the purple color. Okay, so basically, what this means is that they need to have very, very accurate data. They need to carefully track their patient records over time. They also need to share this data across the organization, because what they now need to do is they now need to make sure that the patient is treated and given the best quality service so that they don't get sick again or get sick again too soon, and the outcomes are lasting. Okay, now, and if you think about the American healthcare system and the healthcare organizations, okay, the data was absolutely rubbish. They didn't have the technology, they didn't have the insights into the patients, nobody talked to anybody, and as a result, there was a lot of disorganization and miscommunication, which led to these inefficiencies. So now, what they need is healthcare management technology solutions to carefully track and manage their patients and really help them be more efficient, because that's all the budget they're going to get. Okay, now you guys might be thinking, okay, well look, why would the providers take on risk though, right? They go, well, we'll just not sign up for this whole pay for quality or pay for performance. Why don't we just stick to fee for service? And the answer to your question is because they're being forced to, right? So there's been a lot of amendments and changes to the various legislation. I'm not going to deep dive into all of it, but in effect, what this means is that eventually all of these provider organizations will have to be on the pay for performance or risk-based care model, because the government and the payers, they're no longer going to tolerate inefficient operations, poor patient outcomes, and the likes, right? And so, as you guys can see over here, based on these paragraphs, and there's going to be a lot more, but based on these paragraphs, these were the amendments, and they've been given a deadline, right? So they've been given a deadline, and they said, look, you guys need to change, otherwise, you want to do fee for service, we'll just drastically lower your rates, and you guys just won't be able to make profit or barely make any profit. And so that's why there's been such a big debacle. So if you've been following the American Medicare system, there's two sides that are just absolutely clashing, right? So one's all for the whole, Obamacare socialist, one's for, quality, patient outcomes, the likes, okay? So it's a very, very complex and intricate story. All right, so just to summarize, guys, that's the reason why they now need these population healthcare management systems, because they're being forced to be more efficient and forced to deliver a higher quality service. All right, so moving on, guys. Now, let's talk about the market. This is a very fragmented market, and it's actually still in its infancy. So if we actually have a look at the different healthcare providers and all of the different options, you'll see that nobody really has a massive share of the market, right? So you can see everybody's sort of floating around. You've got some big players like Evolent and Lumeris, whatnot, floating around that sort of 800, 900, $1 billion mark. But nobody's really got a huge hold of the market. So what this means is, this really means that there's an opportunity for somebody who's nimble to capture market share and keep these providers and customers on board. Because to implement one of these solutions, it's massive, right? The implementation cycle is huge. There's a lot of data migration. There's just a lot of stuff. And so once you're in bed with one of these systems, you're very unlikely to leave, right? Because now you've got all your patient records, billing, administration, practice management needs. It's all in one. And so that's why I think that there's a really good opportunity for somebody like an Evolent to establish market dominance. And so just going back to this, guys, this is why, right? Because payers, providers, they all need to take on risk, and they all want to operate profitably and deliver good patient outcomes, okay? And unless you have good quality data, it's basically shit in, shit out, and they don't know how to treat their patients, they don't know the right drugs to give them, they don't know their medical record history, etc., etc. You guys get the idea, okay? All right, so guys, let's now talk about why Evolent Health was sold off, okay? And so from my analysis, there were a few key events that caused the company to get sold off. First of all, back in 2017, they did a capital raising, which was their fourth capital raising in 4 months. Now, you guys might be thinking, okay, guys, this company is raising capital. I'm just going to switch off here. So my challenge to you is have a look at the reasons why, and whether it's capital raising for the sake of destroying shareholder value, or whether there's actually substance, right? Whether that's something to help propel their future growth, okay? Because they made a few key acquisitions. And if it wasn't for these key acquisitions, I don't think the company would be in a position that they are today, which I actually believe is quite a strong market position. So that's the first reason. Okay. The second reason, if you look at number two, the second reason that I suspect that that's had something to do with the sort of market sell-off in October through to December last year, because I wasn't able to find any key reasons. Okay. Now the third reason was because Passport. So just to give you guys some context, Passport is, as of today, Passport is one of the partners that accounts for about 12 to 15% of Evolent Health's revenue. And so what happened was the Kentucky state had done a Medicaid rebate cut. And so basically Passport said, look guys, we probably might end up going broke. And so they ended up suing the government saying, look, you guys can't do this. We serve 25% of the entire Kentucky state. You're going to harm the patient's interests, okay? And so the people thought, oh crap, 15% of Evolent's revenue liquidation, what are we going to do, right? Panic, sold the stock off, okay? Now the fourth reason was actually, funny enough, a few months afterwards, Evolent says, look, we'll actually acquire Passport, okay? So they've gone, okay, we'll just buy them outright. And so the market has basically shat themselves. So they dropped 26% in one day because the market's going, look, what are you guys doing acquiring a company that could potentially go into administration and liquidation, right? And so these are the reasons, as you guys can see here, that drove the violent sell-off of the share price. Now, let's have a look at this and let's go, well, okay, so that's the reason why this is sold off. Is the sell-off justified, right? So let's have a look at whether the stock sell-off is justified or not. And so let's look at the first thing, okay, so the capital raising. Now, I would actually say that that's not justified. And the reason being is because you can see that as soon as it bottomed, it shot straight back up, as quickly as it got sold off. And the reason being is because if we pay careful attention to the little green boxes over here, you'll see that the primary goal of Evolent Health was to go positive EBITDA and then increase the positive EBITDA and maintain it at a key run rate of about, sort of 20% operating margins, okay? So that's their target. And so what does that mean? Well, they made a few acquisitions, so they had to raise capital, but you can see it wasn't all for nothing. Otherwise, the company wouldn't have turned positive EBITDA, let alone continue to increase their revenue. I mean, you look at this revenue growth, guys. It's absolutely massive, right? And so, if it was a poor acquisition, obviously the EBITDA would have gone the other way, and the revenue wouldn't have really gone either way, right? So while you're growing revenues and increasing EBITDA and margins, that's pretty good, right? That means that the acquisitions were, I guess, not silly acquisitions. So that's why I think the first thing is not justified. Now, let's have a look at whether this whole Passport potentially going into liquidation is justified. Okay, so on February, Passport said, look, the Kentucky government has cut our rates. We can't survive. We're going to take you to court. Okay, as you can see here. However, if you look at just about a month and a half after that, Kentucky then has increased the rates. Okay, so Passport's like, oh, okay, well, okay, that's all right. Then, just a few weeks after that, they've boosted the rates yet again because the government has realized, look, we're actually going to be harming, quite a few 100,000 lives. Is this the best? So no. Okay, so then they have to lift the rates back up for Medicaid, and as you can see here, Passport is now optimistic, and they're no longer under threat of going under, right? So is that justified? Look, I don't think it is, and I'll tell you why very shortly. But if you actually look at, I don't think it's justified because if you have a look at the actual population, okay, so Passport has about a quarter share of the entire Medicaid market in Kentucky, and if you guys know anything about sort of that state, there's a huge underbelly. It's quite impoverished. There's a lot of people below the minimum income line to be able to afford their own Medicare, and so as a result, that's going to leave massive problems if these people don't have the healthcare that they need. And so that's why I believe the government's gone, okay, look, actually, we've reduced the rates too much, let's lift it back up, okay? And you can see Passport has consistently maintained about a quarter market share of the entire state. And so As a result, I don't think that's justified, and people might be thinking, okay, so now Evolent's going to buy this organization, and they might be thinking, okay, well, they're going to buy them, has been a risk of liquidation. I still don't think that's a good idea, and so what we'll have to do is we'll have to look at, first of all, the reasons why Evolent has acquired Passport, and also how much they acquired Passport for, because I think the devil lies in the details. Okay, guys? So let's have a look at how much they acquired Passport for. So Evolent is being sued for acquiring Passport for $70 million. Okay, guys? Now, just keep that in mind for a second. So it has 1/4 the Medicaid market share of an entire state, an entire county, for $70 million. Now, I thought, okay, so why would they do that? Why would they go into and make this acquisition? And so the answers lie in the annual reports of Passport Health. Okay, and so what I've done is I've taken 2013 to 2018 and had a look at their net profit after tax per year. So as you guys can see, it's fluctuated between negative $120 something million to positive $114 million. So let's pause for a second and think about this, okay, guys? So why would Evolent Health go and acquire Passport for $70 million? Well, first of all, guys, if they can turn Passport back profitable, and they get it to, back to even $40 million a year, it's basically paid off the acquisition in 2 years, okay, guys? That's the first reason. Second of all, this is what Evolent Health specializes in. So they specialize in helping inefficiently run organizations be more efficient and save. So I'm thinking, okay, well, if they own the organization and they know it in and out, and that's what they specialize in doing, pretty good upside, right? So do I think that the sell-off is justified for them acquiring Passport? No, I don't think it is justified either. All right, guys, so now that we had a look at, first of all, the sell-off and whether it was justified or not, which I believe it isn't, let's have a look at whether management have things under control, okay? So in order to do that, what I want to do is take you through a few key metrics. So the first key metric is obviously the lives on the platform, right? Because the more lives being managed under Evolent Health's healthcare population management platform, the better. And as you can see, the trend has been, consistently, a few ups and downs, but consistently increasing, okay? So in the last 2 years, they've basically increased their lives under management by about 50%. Pretty good. Now let's look at the number of partner organizations, okay? And again, guys, steadily increasing, which is fantastic. Now, the Medicaid lives, which is, because there's the difference Medicare, Medicaid, which I'll explain in the next video, that's also increasing, right? The per member per month that Evolent Health gets paid by the partner organizations, as you can see, that's steadily increasing, okay? Furthermore, they've got now a new revenue stream where they've now broken into the commercial market, which is to serve the healthcare insurance providers. So everything seems to be going on the up. So this is the first sign that I believe management have things under control. And you guys might be going, well, hang on a second. What happened here? How did they go from positive EBITDA to negative EBITDA? Okay, what's going on? Well, look, let's have a look, guys. Okay, so let's have a look at the gross margins. Okay, so their gross margins, have not taken that much of a hit, but the EBITDA has, which tells me that something might have gone on in the background in terms of perhaps some extra operating costs. So let's dig further into that and examine the reasons. All right, guys. So let's just have a look at that. Okay, so. Last year, they added 9 new partners, which was at the high end of their guidance. They keep talking about a strong, diverse pipeline, launching new programs, extra lives. Okay, the tone of the language, it doesn't really come off as somebody who's either in distress or doesn't have things under control. Okay, so what we're looking at here is a collection of different extracts from the last 4 earnings calls. Okay, guys. And so you'll start to pick up a consistent theme where they're going, look, we're winning lots of business, we're winning partners, our pipeline is strong, we expect things to ramp up towards the end of the year, okay, we've got a strong pipeline, it's back-weighted, we're focusing aggressively on deal closures, we've got a lot of deals that we already know that's going to be coming in, we're very feeling very good about our late-stage pipeline. Okay, we've got good visibility into our customers. We've got good pipeline. We expect it to be picking up in the second half. We've got some good tailwinds. We've got a number of new opportunities in our pipelines. We've got several late-stage opportunities. We continue to see interest from these different organizations. We've just signed this new partner with these extra lives. It doesn't really give off the feeling that management do not have things under control, right? Because they're executing on their strategies, right? So they're winning new partners, they're winning new lives, they're launching new programs. So what we really have to do is we have to decide whether they're telling the truth or they're really good liars, right? And so that's led me to go, okay, this is worth diving a little bit deeper. So now that we understand management have things under control, we should have a look at why the quarter one and quarter two revenue declined for their core service, and why their EBITDA went negative, okay? And the answer basically lies in a few things. So first of all, they won a major piece of business in Florida, which required them to front load the expenses and ramp up the plans, okay? So they needed to release 3 new plans, and so they had to hire a lot of people. There was a lot of implementation and background work, and so that's the first reason. The second reason is, if you guys look at the paragraph, is they're moving away from fee-based relationships. So if you think back to what we covered at the start of the video, fee for service, right? They're moving away from providers who are not interested to take on risk, because the more risk that providers and payers take on, the higher margin business Evolent gets. So as a result, they had to churn a few customers that were giving them quite a bit of business in terms of the front end, but those were low margin business. Secondly, McLaren, which was one of their, I think it was worth about sort of 30-40 million revenue to them, they actually decided to take their healthcare population management needs in-house. Now, compounding with the fact that they had to ramp up these plans very, very quickly in the space of a few months, the other thing was that because they ramped the plans up so much and tried to get them out to the market, they didn't actually have enough time or resources to focus on getting the word out and recruiting the necessary people needed. Furthermore, there were a couple of disruptions in terms of the Florida Medicare and Medicaid legislation, and so as a result, it's actually gotten some people to go, look, we'll just stick with the status quo for the next few months, and we'll see how things are in the new financial year. And so, as a result, a combination of front-loaded expenses, churning some partners who aren't willing to move to the risk-based model and are still stuck with fee-for-services, one of their key customers taking a lot of business in-house, and the fact that they had a lot of resources invested into launching these plans, but they didn't put the necessary efforts into marketing and selling them. That's what I believe has caused the reasons, as you may remember from this over here, why the EBITDA went negative, right? So the EBITDA went negative because of the front-loaded expenses. They churned a few partners that weren't willing to do fee-for-service, and so the combination has caused that, right? But as we saw before, from the fact that management has things under control, they've said, look, things will ramp up in the back half. We expect to be profitable again EBITDA-wise. We expect an EBITDA run rate of 50-odd million. So I'm not convinced that that's a massive problem for these guys, okay? All right, guys, so in summary, let's recap what we covered today, okay? So this is the end of part 1. So based on what I've covered today, I believe that there's reason to keep digging into Evolent Health, because they're obviously growing, they're winning business, they've got a strong pipeline, they're winning lives, they're winning partners, and they're doing things right. Okay, so I think that a couple of temporary setbacks has caused the market to overreact, and I don't believe that this is justified. Okay, so what we'll do is, in part 2, we're going to use a combination of their 10Q, 10K, the Center for Medicaid Services, the Kaiser, which is the Medicare Medicaid tracker. We're going to look at their competitors. We're going to do a full win analysis of all their partners. We're going to look at the Medicare RFP schedule for the next 5 years. And we're going to look at a lot of other resources in part 2 to basically project what I believe they're going to win in terms of lives, partnerships, how their per member per month rates are going to increase, to then help us project what I believe is what I believe their operating leverage will be, their revenue for the next 6 to 8 physical quarters, their adjusted EBITDA margins moving forward for the next 6 to 8 physical quarters, catalysts for sentiment reversal, and timeframes for when I think sentiment will reverse, which will then obviously drive the share price back up to the target price that I've set for it. And then we're going to talk about some risks in part 2, okay guys? So guys, I hope you enjoyed part 1 of the video. If you have any questions, feel free to drop them in the comments. And until next time, happy investing, and I'll see you guys in part 2 of the Evolent Health video analysis.